Trauma, it could be some combination of ACE, means sexual abuse, physical abuse, mental abuse, social abuse related to the childhood stage. So the child maybe could have been in such a situation like family separations, sexual assault, physical abuse. Trauma can lead you to chronic disease, social abuse, emotional abuse, physical abuse, whatever it is, and that abuse will lead you to the drug abuse.
Okay, a child has gone through trauma, has developed, is an adult. Now we realize this adult is doing what he's doing because of childhood trauma. How do we correct? What are the correct measures?
Okay, maybe we can say in simple is a solution of childhood
Yes.
trauma.
Yes.
Okay, the solution is first it's assessing yourself. Maybe assessing yourself. The child is not able to assess his or herself, but the parent, through the help of the parent, the help of the religious like the religious leaders and the parent, there the child will be able to assess yourself. But in adulthood, you can assess yourself by knowing what you are doing right now, what you are fearing to do, and you know it's right, where you are stuck, and what the cause of you being stuck. So it's all about assessing yourself. Assessing yourself is there. We say you are capable to get up or to end up with a point there you can say I need a therapy, I need someone to talk to. Another thing is to find a third party to talk about your childhood trauma or your problem you are facing right now. Having a therapist is the point there we can say you are mentally stable. Another thing, it's where you can be able to express yourself to the elders one, to the people who have the good skills of managing these things. Because sometimes people, they are able to express themselves, but they do not express themselves to the surrounded to the people who are right or who have the certain skills of discussing a certain subject. They meet the wrong peoples on their discussion.
How do you get to know? Because the society right now, there's not much information going around about these issues. I could be suffering, but I don't even know I am suffering. I could be suffering, and yet I don't know where to go to for help. What is the solution?
My suggestion, it's like to improve community awareness about mental health issues, to improve community awareness about traumatic issues, because the relation between trauma and PTSD, post-traumatic disease syndrome, is very relatable. I can say there is a lot of chances for the people who are facing childhood trauma to end up with PTSD. And once you end up with PTSD, that is another problem.
PTSD is post-traumatic
syndrome.
Yeah.
PTSD, it's post-traumatic syndrome. So like the relationship between trauma and PTSD ni kubwa sana. Kwa hiyo should I allow to speak Swahili?
We prefer English because it's going further than just the continent.
I want us to to talk about a few things about that PTSD, post-traumatic
Yes.
stress disorder.
Yeah.
This is a mental health condition that is
Mm.
triggered by terrifying events, either experiencing or witnessing. Kwa hiyo, so sorry, it's a mental health condition that is triggered by a terrifying events, either experiencing or witnessing it. So if the child experiences such kind of ACE,
Yeah.
like physical abuse, emotional abuse, and whatever, or if a child witnessing, like you can say, if the child have been growing up in the environment where there is addictive parent, where there is physical abuse parents, a lot of gangster stuff or savage lifestyle, it could be either the child to end up with PTSD. So
Mm.
the symptoms of PTSD, it's like a flashback, nightmare, severe anxiety, uncontrolled thoughts. Here we can stick with severe anxiety and uncontrolled thought. Through severe anxiety and uncontrolled thought, the children or an adult can lack self-awareness or can suffer
When
emotion
you talk
abuse.
about uncontrolled thoughts,
Yes.
can you explain a little further for us to understand?
Uncontrolled thought, it maybe you have a thought of suicide. Maybe we can say about suicide because
Or
the
you are
trauma can
suicidal?
suicide, madam.
Yeah. Yes.
Because a trauma can lead you to the suicide thought. Maybe you have this thought of suicide, thought of being isolation, thought of being abandoned. So we can say uncontrolled thought because it the thing which is going on in your mind, you haven't make a solution, or you haven't not make uh, a good escape of a certain thought like a suicide.
Mm.
Yeah,
Okay. Yeah. So you
yeah.
can continue. Thank you.
I can continue.
Yes.
Very sorry, very sorry, very sorry. We were talking about the solution.
Yeah.
Yeah, we were talking about the solution, and those solution we can say it's assessing yourself. Maybe you can help to explain a little bit
Mm.
about how assessing yourself could be the solution of childhood trauma, madam. Sorry.
Assessing yourself. Okay. You can
Yes.
assess yourself only if you are aware. You are aware of what you're going through. You're aware that you're having an issue. And you can only be aware if there is information out there. So first of all, we as the people in the profession, we need to give out more information about such issues, because a lot of people in the society are suffering, but they are not aware. So they cannot assess themselves.
Yes.
Yeah.
Yeah, and maybe finally I can say that if you are facing trauma, hence you have stress issues or depression issues, hence you need a good team or expertise or for talking about that issues. So in order for you to know and to find a solution, you need to managing yourself about what is going on in your life, considering your life experiencing, considering you are witnessing some things in certain point in your life that could be the problem, and the things you are not able to get through it. So for you to manage all kind of those things, you need to rethink, relax, release, uh, reorganize, rethink, relax, and reorganize. Like you go through what is going on in your mind. Don't be overthinker. I'm not saying for the people to be overthinker. I say for the people to rethink in order to get the crucial point, to have the self meeting, in order to end up with good point. Like, okay, maybe I am facing suicidal issues, thoughts. That is my uncontrolled thought. Maybe I am facing isolation thought. Maybe I am facing sabotage thought and all of those stuff. So what should I need to do in order to be a mental wellness person? Apart from seeking a third party, or to seeking from a counseling from the expertise, maybe it's an environment which trigger you, because like there are things we are going through right now. It's because we have been, or we are being in the environment that it triggers our emotion issues, so we need to set boundaries, our own boundary on the things which we are capable of. Like I'm not up to end up on abusing anything, because my parents or me, I have been in such kind of situation. Maybe this could not happen to my wife. Maybe I don't want this to happen to my children. Maybe I don't want this to happen to the society. You need to help them, considering your bad experiencing, considering what you have been through during your childhood age. So like another things, you can set the boundaries. We can say you set the boundary for the things you are capable to manage. Another thing, you are managing your emotion very well. Another things, you align your goals and value. Hence, once you know your goal and your values, for the thing which you want to get solution of, there you could have to build your self-esteem, your self-awareness, and you'll be capable to seek for the third party session.
Thank you. And I don't know whether this is taking us back, but I wanted us to talk a little bit about the impact of trauma on people, on adults, impact of childhood trauma on us adults, or on children, like in school and so on. How does childhood trauma impact on personality? Maybe learning
Uh,
issues.
Childhood trauma has nothing to do with our personality. Maybe people who is introverted or extroverted, we are not considered a childhood trauma is the result of introverted or extroverted. Though in a lot of studies they say if the people who is introverted, it's because he or she lack a good cycle, as a good people surrounded him or her for talking about his or her stuff, for sharing about his or her stuff. We can say that a lot of introverted people, they are facing lack of good people to surround them, to talk about their stuff, to speak about their stuff, to sharing their thoughts. Hence, an extroverted people, it is for them to talk about their stuff, because they have that character of socialism. They can engage to different topic in the street, in the community. They can engage to different events in the society, in the community, compared to introverted people. So maybe I can go to answer that question by saying that impact of childhood trauma can lead to bad bad we can say a bad organizing skills at work. You can have a poor organizing skills at work. You can have a poor performance at work, at society, in different aspects in the life, because you have a lot of things going on in your mind, in your heart. Hence, it is unhealed scar, unhealed events. So you can, it's easy for you to bring those thoughts to your work. It is for you to bring those thoughts to your relationship. So a lot of relationship is not a stable, healthy relationship, because one of the partner in that relationship, he or her faced the childhood trauma, and he or her not stable to seek for third party session.
So childhood trauma can impact on relationships, on
Unstable marriage, like unhealthy relationship, working performance, like general, it decreases the improvement or the efficiency of work in the society, like in the working occupational place. It increases the development of the good marriage. It decreases the development of good governing system. The impact is to low the production, to uh, to make you to undermine thing that is positive to the society, because you have those feelings like you don't trust others to do things. You have the feelings of perfection. You think you are a perfect person. You don't want to be challenged. You don't want someone to speak about you about a certain topic, because you think you have that feelings we call in a school superiority complex. Yeah.
Yeah. Now, you also mentioned earlier that childhood trauma can normally develop into poor health diseases.
Yes. We of course, for me right now, I am facing a lot of disease called including considering mental health. Like for those addictive people, it could be the result of childhood trauma. It could be the result of society stigmatization, and that society stigmatization may be the leader of in the society, or maybe the society itself is facing a lot of traumatic events at the early stage. So I'm dealing with addictive people and non-addictive people. For those people who are facing schizophrenic, bipolars, depressions, and the addictive people. So also in chronic disease, like we can say hypertension. Hypertension could be the cause of a childhood trauma in a certain event. Hence, the people keep thinking, overstressing him or herself about the things which he or he has not good solution or good knowledge about it, because there are a lot of fake knowledge in the society or in the community right now. So people, they don't meet the right people for talking about their things. Hence, is a due to stressful or depression, it's possible the person to end up with hypertension disease. Due to stress or depression, it's possible for the person to end up with diabetic disease, because there are these things in science. We say our body reaction trigger our hormone productions. That's why when you are in forest, and you saw a lion, your body started to produce those hormones like adrenaline and all those hormones. The hormone give you those uh, interpretation, maybe run or fight against lion. So if you are in the house where the lion is the husband, if you are in the house where the lion is the father, if you are in the class where the lion is the teacher, if you are in the society where the lion is a chairperson, you understand? So
Yeah.
you keep facing that lion in your daily life, and you don't have a solution about killing, whether to kill that lion or to run from that lion. And that is your day life, and your body keep producing and triggering the body to produce those hormones of fighting against Anisha's environment.
Yeah.
Yeah.
Yeah. That is true. Now,
Yeah.
we have covered quite a lot, but I want to give you a chance if there's anything that you think we have not talked about, which you would like to convey to the public.
What once I can say, madam, before anything, it's like I just want people to understand it. Healing is a process. Healing is the journey. It's the journey of painful and goodness. If you admit or you want to be healing, you need to admit you are going through a journey of painful. If any growth, any changes, any challenging in your life, and you want it to you want to get from point A to point B, there is a process. We need to enjoy the process, and the enjoyment of the process there is painful. I just want people to understand there is a painful moment. There is a painful moment through growth, through any journey of life. So healing is the journey. If you want to be healthy, accept it, go through it, seek the right third party, the right expertise of whom to talk with your problem, of whom to share in your problem. Not anybody is capable to handle what you are sharing with, because there is stuff we call the confidentiality. There is stuff we call empath. If you want to talk about empath is not about feelings what others feelings. It's about feelings and understanding what others going through, what you are capable of helping others. Because right now at work, there are a lot of people who are facing depression. Maybe it's because of childhood traumas, but because of working performance is low. The manager or the supervisors, they don't want to ask about what is wrong with you, what is going on with you, because this month you don't reach the target. They don't want to talk about that. Maybe someone, he or she has faced the physical abuse in his or her daily life. So like we need to have this a real impact. We need to have a real expertise of whom we can talk and sharing our stuff. We need to have a real kind shoulders of whom we can talk and sharing our stuff. I think those we can help to reduce the suicidal rate, because we have a lot of suicidal rate, and this will help us to avoid a number of addictive people in the society. Because now in Africa, I see we don't do a lot of creativities in our work. We wait for the technology to come to our society, and then we adapt and then accept that technology, because we think we are not capable, we are not able to do our stuff or to make our thing better than them. We are better than them because we are not colonized mental. We are mentally free. If we are mentally free, now it's the time for society to wake up and to talk about our children and to teach about our children. Now is the time the mosque and churching to wake up, to preach about LGBTQ, to preach about those ACE, the children who they are facing, to teach about those those kind of abuse, the marriage they are facing, the toxic relationship, the narcissism relationship. There are a lot in society which we are we are blind of with. We are not blind. We see, kwamba we feel like this is not right and this is not fine. We need to make the interpretation. So now I think a lot we face the trauma because there is a fear of conflict. The pastor or the mother or the teacher fearing to tell the parent like your child now is committing LGBTQ because of conflict. We need to avoid those things. We need we are not supposed to abandon ourselves as African society because we are intellectually enough, considering the history which is not favored us until now, because we are very, very intellectual enough. There are things I want people to go and read. We call Kamet. Kamet, it's like the history of algebraic, the history of those prophets about the Sudanese, the Misri, and all over the North and East Africa. We were doing great back then. We are great, you know, mommy. So we need to raise the awareness in the community for those our children to face and to make the solution for those trauma stuff, for those we can say in good English, unsolved issues. Unsolved issue, like you can help me to put in good terms, like there are a lot of life aspect which is unsolved. I don't know in one terms where you can put in good English, but there are a lot of unsolved life aspect we are facing right now. So I advise and I am encouraging people to know the healing is a process and the journey of painful. So we need to avoid and to reduce the number of addictive people because we need a productive society. We need to have a productive generations. I think it's the time where the politics should not be intervened in our life directly. Should not have the impact in our life directly. Because we saw a lot of youth, they are being used in the we call political strategy. I can say it's not a good term in politics, but a political strategy for the leader or for the people to reach their point, to reach their destination. And the youth, they lost their life. The youth, they end up in addiction, in drug abuse. The youth, they end up in rape, in sexual assault. There are a lot of civil war going on because people in the world now, they want to meet their demand. We unmeet their demand. We unmeet our childhood aspect. We unmeet our childhood destination. We are not meet yet. We need to meet our future. We need to meet our goal. So we need to set boundaries for those things which has negative impact in your next life, in your day-to-day life. I think, Mama, now I'm okay with that.
Yeah, thank you so much. Thank you. You have given us quite a bit on trauma, and we know that it is going to help somebody somewhere. We go one step at a time. We go one person at a time. If one person is helped through this, we thank God for that. So I will say thank you very much for.
Maybe I can conclude about say there are things we say if people see things called adversity childhood trauma. It's the same like childhood trauma. So adversity childhood trauma, it's depending in different in two types. There are high dose and low dose. And high dose of adversity childhood, high dose of adversity can lead a person into we can say can lead a person into a bad or a poor life aspect because early adversity dramatical across in our lifetime. Across in our lifetime. That's why you can say maybe the character you have right now is it's because there is period or events of childhood trauma. That's why you are act like that. That's why you are presenting like that. That's why you have a certain thought. That's why you have a certain feelings. Okay, mommy. So like those advised those or high advised those can dramatical across to our health in lifetime. So we need to take a look of it because a lifetime it's another things. Maybe like you can have been facing a one sheet or a certain sheet in your day-to-day life, in your whole time of being living as a human being. And if you are emotion abuse, you are not living because you are a slave of something. So we don't want people to be the slave of anything. We want people, if you are a religious person, to be a slave of God. We don't want you to be a slave of a third-party therapy. We want to help you to get to get a breakthrough for what you are going through. But we don't want you to be the slave of a counselor, of a psychologist, of a doctor, because it will need you to take your daily medication for depression, for anxiety. It will lead you to have a different session after every week. We don't want that. We don't want to speak about you about what is a good measures of you to make a solution for the problem you are facing. So we need to detect those characteristics at early stage. We don't want to end up with PTSD. We don't want to end up with the prescription of drug. We need to end up with knowledge up. We need to give you knowledge. We need to know to encourage you to find knowledge. We need to encourage you to find the right people for you to get to escape of life-threatening disease, to get escape of day-to-day demanding of therapy session, day-to-day demand of hospital medication for depression and everything. And everything in life we are doing has its impact, whether it's negative or positive. But the negative impact, it is in large amount or quantity in African society rather than the positive impact.
Yeah. Thank you so much, Doctor. You have given us quite a bit of information on trauma, and we appreciate that. Now,
thank you, madam.
Yes, thank you very much for watching this episode of Mental Wellness Insights. We pray that you will share this information so that such important information reaches a larger population. More people will be educated on such issues.